Hi, everyone. Thank you so much for joining me for Let's Chat. My name is Shayla Reeves, and today we're going to be tackling a topic that really can impact anyone, any age, no matter where you live, no matter when someone there might be someone in your life that may have to make that trip to the hospital, and there's some anxiety around that, and whether or not you know all the right questions to ask, and whether or not you're really creating the best experience for the person that you love. So I wanted to have this conversation because it can feel overwhelming when you go to the hospital. You don't know what to ask, and maybe there are some questions that you should ask and you don't know that you need to. So we've got an amazing group of doctors and nurses joining us today for Let's Chat. And we're going to be talking about advocating for yourself and for your family. So I'll go ahead and bring them all up individually right now. First, we have Dr. Nancy Utley. This is actually a childhood friend of mine. And when I decided to have this topic, I started looking at all of my connections, everyone I know. And I said, Nancy and I, this would be a great chance for us to reconnect and also get some information out there that would be beneficial to people who are dealing with pregnancy, or maybe you have questions when you're going to the hospital, you don't know what to ask. Nancy is great for that, and she'll be joining us this evening for this conversation. We also have Dr. Endea Curry joining us here today. Dr. Endea is a doctor here in Minnesota, and she's going to be offering some information and insight for you once you if you have to make that trip to the hospital, you're not sure what to ask, Dr. Endea will be able to provide some insight for us today as well. Joining us again today, we have Latasha Curry. She is a nurse and also an instructor for a school for CP certified nursing assistants here in the Twin Cities. So she'll be able to offer some insight as well on the topic that we're discussing today. And last but not least, we have the wonderful Myriam Roby joining us here today. And I look forward to having this conversation with all of you and hopefully getting some information out there to folks that will be beneficial on their next trip to the hospital. We hope that people don't have to wait till the last minute until things are bad. We want them to keep an eye on anything that they're dealing with or tackling and stay on top of it. But when you get through those doors, you might be wondering, I don't know what to ask. What are they saying? What are they telling me? What do I need to know? And you guys are the perfect group to answer some of those questions. So I'll start with you, Dr. Curry. When I brought this topic up, you were enthusiastic about it. You said, oh my gosh, I'm the one that gets asked all the time, what do I need to know? Tell me about your experience to get us started.
All right. So yeah, I work as a clinic physician as well as a hospitalist at Regents Hospital, and I have been doing this for probably about 13 years now. And so, and I should say I've also been on the other side of, of this kind of the circus of being in the hospital and that type of thing, unfortunately, with various family members. And so the one thing that I'm definitely happy is that I have kind of the insight to be able to know what to ask and know kind of how things go. And so yeah, I definitely think it's very important to have someone with you and to listen and write down what's going on, because you're getting thrown so much information. There's so many tests and things like that going on. So yeah, my experience comes from basically both parts of working as a physician and also, unfortunately, being on the other side of that as a patient advocate.
All right. Thank you so much, Dr. Curry. And Nancy, you're an obstetrician and gynecologist. Can you tell us a little bit about your work? And then maybe we'll launch just in a minute or two, a little bit more in depth on some of the questions you feel that people don't ask often enough. But just tell us a little about who you are to get started.
Hi, excuse me. I, in addition to being a childhood friend of Shayla, am a OBGYN. I practice in our hometown of Jackson, Tennessee. I do inpatient and outpatient management of both obstetrics and full coverage gynecology. And one of the really nice interesting things about where I live is we're kind of all by ourselves. Memphis and Nashville are the closest things that we really, where we live, see all kinds of interesting stuff because there's nowhere else to go. All of the local hospitals have almost all closed, and we have become kind of a referral center. So I love where I am because I get to see all the stuff and take care of a wide variety of things, which is really nice. I think from an inpatient standpoint, the thing that is the most important to me when I'm talking to a patient or a patient's family is feeling like they understand and they know what's going on. I am always amazed when I come back in the next day or see someone in follow-up in the office, what a small piece of the conversation they actually remember, because there's so much going on. I think it's really hard. So like, as Dr. Curry said, having someone there to take notes, but also to be able to stop and say, I don't understand what's going on. Can you explain to me what this test means and why you feel that way? Because I think if you feel empowered enough to ask those questions, then it helps you feel more comfortable with these decisions that in the hospital, unfortunately, happen really rapid fire. When it's on an outpatient setting, it's more, let's talk about the 5 different things we can do and what's the right choice. But if you're sick enough to be in the hospital with some of this, you're making decisions that are a little bit more risky usually because they have to be made quickly because you're so sick.
All right. Thank you so much, Nancy. And I want to start next with Latasha. If you could tell me just a little bit about your experience and what you hope to contribute to the conversation today. If you could turn your microphone on.
Okay.
Perfect.
Hello, everyone. My name is Latasha Lee. I'm a registered nurse at the master's level. Currently, I work at Children's Pediatric Hospital in Minneapolis. I also have a certified nursing assistant school in Crystal, Minnesota. So when Shayla mentioned this topic to me, I was very excited to kind of be a part of this panel because I feel that sometimes whenever patients are in the hospital, they're a little bit overwhelmed. And I feel like sometimes with whenever they're overwhelmed, they don't always know what to ask. So I'm really excited to get to the nitty gritty. Like Shayla said, tell a little bit about me, but when we move on to the next section, I'm really excited because I have a lot to offer.
Thank you so much, Latasha. And last but not least, Myriam Roby. I'll go ahead and bring you up now. Thanks, Myriam, for joining us. And could you turn your microphone on too? There we go.
There, yay. Hi, thanks for inviting me, Shayla. I appreciate it. My name's Myriam Roby, as you mentioned. I'm a family nurse practitioner. I've been practicing for 7 years now. Prior to that, I was a registered nurse for 10 years. I, like Dr. Curry, also work in the Health Partners Park Nicollet family. I'm a hospitalist. I've been working as a hospitalist for many years now. For those that need a little bit bio on a hospitalist, essentially it's an internal medicine provider, but works exclusively in the hospital. So I'm exclusively in the hospital. Dr. Curry will work in the clinic and the hospital, and then but my role is in the hospital, and then I would transition any patients to Dr. Curry if need be when they hand out. So, and I also am very, very excited about being part of this panel. The advocacy is something that we really promote being in the hospital setting. The main thing we'd like for patients and their families to recognize that they need to be an advocate for themselves. It's very, very important to be an involved and active partner with the clinician. At any point, if you're not understanding things that are being mentioned, ask clarifying questions. if we're offering certain preferred treatments, diagnostic or screening evaluations, and you don't understand exactly the lingo that we're mentioning, that's the time to stop us and say, can you bring it down to, in a little bit more layman's terms, explain to me exactly what is it that you want for us to do? How do we collaboratively work together, and then create something that would be beneficial for you in the most part, but then able to work with us so that we can try to optimally take care of you. So I'm also, just like Latasha, very excited, have a lot of information that I'd like to supply. So I hope that we have plenty of questions from your audience.
Thank you so much, Myriam. And I will go ahead and tell everyone, if you're just now tuning in, we are talking about medical care, advocating for yourself and for your family. So it can kind of feel tricky or overwhelming if you have to make that trip to the hospital and you don't have to go very often. You're a little overwhelmed. You're hearing a lot of words, a lot of language that feel like, what is this? What are they talking about? What are they telling me? Can I make the right decision? What do I need to know? This conversation is a space where doctors and nurses who see patients that come to the hospital, they're going to talk to us tonight about some of the things that they don't get asked often enough, things they wish people asked more. You have a chance as well, if you would like to join the conversation, where you can ask a question in the comments. We can post that question here on the screen, give the doctors a chance to answer it. You can also join us via video, and we can bring you up that way too, if you would like to ask a question that way, because we know realistically a lot of folks have been spending more time in the hospital than they would like over the last year dealing with the pandemic. But that is the hand that we've been dealt. And so how do we best position ourselves and our loved ones to be an advocate for ourselves and our loved ones? So I'll go ahead and start with you, Dr. Endea. If you could think of one or two or three top things that you say, I wish that people who came to the hospital would ask these questions and they don't ask them enough, what would those questions be?
Yeah, I would say, one of the things is, and I'm sometimes guilty of this as well, or what are my test results? So when you come in and we order blood work, we order imaging, and we make kind of decisions based on what we see. And sometimes we don't have time to get back to talk to the patient about what we're doing, why we're doing it at that moment. And so making sure that someone is followed up with you on your test results, whether it's blood tests, any imaging that you had done, any procedures that you had done, because sometimes, you might have a medication that you had on board, so you might not remember exactly what's told to you. So understanding finding out your results. So that's one thing I think people should ask about. Another thing is to get kind of an idea of what the doctor thinks could or could not be going on. So, what do you think is going on? And then that way they can kind of lay out the plan for you, so what potentially the next steps will be. So I think that's important. And I think lastly, it's not so much as a question, but understanding how a hospital works. There are a lot of the tests, and sometimes people's tests can be bumped behind if someone more sick comes in for certain procedures. And so we don't often know the timing. If it's not an emergency, unfortunately, your whatever test you have ordered may be pushed back. And so understanding that the time that they give you for a specific test may not be the time that you actually go for it. So.
All right. Thank you so much, Dr. Endea. And Latasha, I know you've talked a little bit about it before. There's some fear around going to the hospital, and sometimes people will sit at home dealing with symptoms of things and they're afraid to go because they don't want to hear the answer. And I've heard you say before, I mean, the sooner you can get in there, the better, because sometimes maybe there's a solution that keeps you from spending more time in the hospital, and maybe you can, get in and get out with less time if you just have the courage to face whatever that challenge is, right?
Yes, thank you, Shayla. So I would like to just share with everyone, the sooner you come in, the sooner we're able to help you, and the sooner you can start your care. Oftentimes, patients do have a fear. Going to the hospital can be very intimidating. I understand that. However, we can give you the best care once we know there's what the problem is. I'm sorry. We can give the best care once you come in, and then we can work on your health history, and then we can determine the right differential diagnosis or the right diagnoses pertaining to your health concern, and then we can start your treatment. Another thing that I kind of wanted to share, oftentimes whenever the patients are in the hospital, sometimes they're coming in for the same symptoms, the same illness, the same disease, and they often expect doctors and nurses to complete acts of God. Now, when I say that, I'm being a little bit sarcastic. But what I mean by that is sometimes they're coming in for the same thing because they're not taking their medicine, they're not eating the right diet, they're not exercising, they're still living a sedentary lifestyle. So a question that I would like patients to start asking when they come in the hospital is, how can I, as a patient, help myself? Once the doctor determines what I need, they provide the medicine. What are the actions that I need to do for myself to make sure that I get the best results from the doctor's diagnoses, but also from the medications and the recommendations of the provider? And then lastly, sometimes when they come in, they're often alone. I feel like when you go to the hospital, you're very overwhelmed, you're stressed out. Sometimes when we're anxious and uneasy, it's hard to remember viable pieces of information. So I would like for every patient, anytime you go to the hospital, if there's a support person available that can advocate for you and help you deliver your message to the physician, I think that's beneficial. And also give consent in the event that you're having trouble. It's okay for the doctor to talk to whoever the delegated person is that you'd have him or her talk to pertaining to your care.
And Nancy, would you like to add to that, Dr. Utley?
I just think it's such a good point to have someone for consent, because if you're not feeling great, you need someone else who knows you, who knows what your preferences are, to help you make the decision that you would want for yourself. So to have that other family member or whoever it may be to be there to help you through that, I think it will make them feel more comfortable on the backside of things, but also you that, as things were moving along, you got the care that you would have wanted for yourself.
Okay. Absolutely. And Dr. Curry, would you like to add to that?
You want to ask me?
Yes, I was asking, would you like to add to that perspective? Just, even if somebody's going to be going to the hospital, just articulating, what your wants and needs are while you can still do that to someone else, so that if, by chance you might be incapacitated, your wishes can be followed. Just having those conversations, they may feel tough to have, but just having them can make a difference in your care, right?
Oh, definitely. I advocate everyone definitely have, if you don't have, like, say, a healthcare directive, and which would actually assign someone for you, then, have someone that at least that we can talk to and give information to, if need be. But I am a big proponent for having a healthcare directive, which will outline, things that you wouldn't want or would want done in case, you are unable to make those decisions. And I think that's really, at all adult ages, is really, quite prudent to have. It doesn't matter if you're younger or older. I think it's always important to have something down, because it'll assign someone that you are, that can talk for you if you're not able to make those decisions. So I definitely agree with that.
Okay, thank you so much. And Miriam, one of the things that I can say, even in my own family, when you have grandparents that are going to the hospital or the doctor's appointment and they go on their own, and then you ask them later, how was your appointment? What did the doctor say? And they don't remember what they said, or they say, well, I think it wasn't that bad. And then, if somebody with the family calls and follows up on what was actually discussed in that appointment, you learn way more than you did in that conversation. And so even with the elders in your family, or even if it's just you, I think sometimes people may feel embarrassed to ask for help, but sometimes it's the overcoming of that can really make a difference in what kind of treatment, what kind of care, what kind of experience you have if you go. Just ask for help, right?
I think okay, yeah. Shayla, perfect. I couldn't have said it any better. And to draw on Latasha's point, I'll re-engage what she had mentioned, that anytime you are finding yourself that you need to go to a clinic, or unfortunately present yourself in a hospital setting, it's overwhelming. Having detailed documents, such as your past medical history, your current prescription list, would be beneficial. If I'm coming, typically I'm rounding on you in the emergency room, and it's frightening, right? And there may be things that you may forget, and if you have that paperwork with you, it's not something that you have to think about. You essentially just hand me over the paperwork, and then I can document that, and we can push forward. Also, what Latasha mentioned in your previous podcast in nursing across cultures, the having a family or friend with you that can assist with you in helping some of those decisions. I just wanted to expound on that a little bit. What would be beneficial is if you would have someone who that is key in knowing your specific diagnosis, history, and medications. We would need somebody that would help expedite your care, not someone that doesn't know much about what's going on. And what we want to do is we want to make sure that we're getting to your care as soon as possible. Dr. Curry mentioned a healthcare directive or a PULSE. Essentially, just to reiterate, that's a formal document that would have specific medical orders determined by the patient. And it is to be honored by us, the healthcare worker, in a medical crisis, so that we can decide with you, how would you want us to proceed with your care? And having that available, having your family member or friend understand that, and when we would ask that question, then you wouldn't be able to have, discrepancies, or where your loved one would not agree with it. Having that already in a agreed upon state is the best during that time. So I think just key point to remember, when you're coming to the hospital, this is very stressful, right? It's not a vacation. It's not something that you planned upon. If you have almost a kit, if you will, where you have your documentation available so that you can readily grab it, go to the hospital, you explain what's happening, we can expedite your care, we can document, we can make sure that we have your past medical history listed, so that when it's time for us to admit you, we know your entire history and we can move forward. So that's the main thing that I just want to really reinforce. And again, I can't stress it enough. This is a collaboration between us and you. Anything that you have, any core beliefs, For example, if you're a Jehovah's Witness and you do not want us to give any blood products, let us know that. This is not something to be embarrassed about. This is something to be transparent and let us know. We want to make sure that we're abiding by what you want us to do. This is a collaboration between you and us and how we can make sure that we optimize your care.
And what I'm hearing from you, thank you, Myriam, and from the other doctors and Latasha as well, is there are some easy things that people can do before they end up in that wheelchair, on that hospital bed, before they even walk in the door. You could, when you're healthy and feeling fine, make that list of your current medications, have that available, maybe stick it on your fridge or something. So if there's an emergency, you can quickly grab that and go. Or if there are specific wishes that you may have, put those down in writing too, in a safe space. Maybe create a little packet for yourself and tell the one or two people that may be inclined to be your voice when you go to the hospital. Say, hey, this is my current medication. These are what my wishes are. This is what you need to know. And you can fill all that stuff out beforehand and have that in a quick place. Because if people are going to the hospital, if it's an emergency, sometimes they may feel overwhelmed and you're getting questions quickly and you can't think of all those things that maybe your doctor or nurse needs to know right away, right? Dr. Utley?
I think to piggyback onto that, another thing that's very difficult to remember in the moment is which doctor or nurse practitioner do you see for what problem? So, when someone comes in with a pregnancy that's complicated, my first question is, okay, who is your high-risk pregnancy doctor? Where we live, that's not a big deal because there's only one. But in bigger cities where there are multiple places you might be getting care, to know who that person is so that we can quickly get records of things that are more significant than what you would probably keep up with yourself. It's important to know that. And it helps us get that information much more quickly.
Absolutely. And Dr. Curry, would you like to add to that?
Yes, I think those are definitely excellent points. The one thing I would add would be take a picture. So if you have your updated medication list, take a picture of it. Even take a picture of your medication bottles. And I think having that kit together, like Myriam had stated, is so helpful. One of the big errors that can occur, especially with transitions, so from being admitted to the hospital to being discharged from the hospital, are medication errors. And there can be medication changes depending on what you came in the hospital for. And so that's another thing to understand and to inquire about is, okay, what is this new medication? What are the potential side effects? Because again, sometimes we don't always sit and explain, what could be going on. But it's definitely important to know what your medication, especially if there's any new medications. Also, understanding what your medications are for, even before you come into the hospital. A lot of people will say, I'm on this medication and it's a blood pressure medication. They don't know it's actually for their blood pressure, or it might be for their heart or different things, or they don't know why they take aspirin or why they take the dose of aspirin that they take. And so I think it's so important to understand, have your primary care doctor even explain to you what is each medication for. Within our system, we now have capabilities where we can actually put an indication on your prescription. So, I will often click, okay, there's lisinopril, for example, is a blood pressure medication. And I can click on there because it's all electronically. This is for high blood pressure, and it'll print on your label, And so I think it's really important to know what you're taking, why you're taking it, even if you don't remember. But to have that list, whether you're taking a picture of it that you can bring in, and when we change something and you understand why we changed it, I think that's important too. And if you don't know, make sure that is relayed to you. If it's not in your discharge orders or instructions, or you don't remember from your visit, that's another big piece.
All right. Thank you so much, Dr. Curry. Latasha, would you like to add to some of the perspectives as well? Oh, yeah, I think you're on mute.
Sorry.
You got it. Thank you.
Sorry about that. I think I kind of already kind kind of talked about that. So
Okay.
I don't really have anything else to offer for that part.
Okay. All right. Thanks so much. I'll go ahead and ask you the next question, jumping into it. One of the stories that you told that really resonated during our conversation on nursing across cultures was about a friend of yours that did have to go to the hospital, and the experience that they had with the medical professionals. If you could share that again. It was somebody that went recently and they had an issue, and I think they had to go back. And then finally, they figured out days later what their actual experience was that they were having. Could you share that story again?
Okay. So I've had a couple different stories. I'll try to remember that particular story. Most recently, the one that comes to my memory was there was a young African American woman, and she had went into an adult hospital, actually several, and she was in the emergency room for extended periods of time. She was really sick. She had lost a substantial amount of weight in a short period of time. But she was turned away. Like, they kept telling her she was okay. It was just nausea. She went home with like a nausea medicine, Zofran. And so she ended up going to another facility. And at that facility, a thorough, in-depth health history was obtained, because when she got to the unit, she kind of shared that she was afraid and that she felt like her voice wasn't being heard and that she was just going to be pushed out of the door in the morning. So basically what happened was, during the interview process, we were able to elicit very pertinent data that gave an extensive history for quite some time. And when we obtained the information in the health history, it was like an aha moment for not only the nurses, but the doctor, the social worker. There was a plethora of people that came on board to support the scenario that this individual was facing. I'm not really sure what was happening at the other hospitals and how the interview process went, but I'm going to get a little bit of emotional. Sorry. I'm not really sure what happened during the interview process, but when the patient was able to tell her story, and we actually sat there and listened. When she was done, she was in tears. She thanked us for listening to her story. She thanked us for even acknowledging the things that she said to us. And she also thanked us because she felt like she was going to live after that experience, because she had been turned away so much. And I just got to tell you, there was some consults that had to come in. There was some specialists that had to come in and help this patient. And the reason why I think this is relevant here is because advocacy is really important. And this patient stood out for me because even though she was told no several times, she continued to go to hospital after hospital after hospital until somebody listened to her. It's really unfortunate that that patients have to go through that. But at the same time, don't give up. If you feel like there's something wrong with you and nobody's listening, keep going. Ask for supervisors. Go to higher up. If you have a doctor that's not understanding, maybe ask for somebody else that may understand it differently. There was just a plethora of things that was wrong about the situation. And I'm just going to be honest. It was a Black woman, and all the providers that she had prior to having that interview with her Black nurse were white providers, and they were all white male providers. And it's sad, but it's true. And this happens a lot in America.
And Dr. Curry, what do you say to people, I guess kind of piggybacking off of Latasha, just because you get one answer from one doctor and you still feel something, don't stop there, because you probably know your body better than anyone. If you just have that feeling that it's not right, keep going.
All right, so I have a few thoughts related to that. I think that, for one, it is very important to find and develop a rapport with a primary care provider. So someone who can have your back with the medical background. So I think that's important. I think that's really the foundation of a kind of preventative lifestyle. The second thing I will say is also, if you are going through something, and you're having multiple tests, there's a few things. You have to weigh the balance of working with a provider, if it's someone that you trust, and working with them to figure it out. And I used to go through this with my sister a lot. Now she would have to go to the hospital for something. Well, what did they find? Nothing. They told me nothing was wrong. I said, no, they did not tell you nothing. What test did you have? What did they tell you? Because patients will often do this also, is they will say nothing. They told me there was nothing wrong. Well, they didn't say nothing was wrong, but they said, okay, we can tell from your CT of your abdomen and pelvis, this is not appendicitis, right? We can tell from your blood work, your white count's not high, so this is not an infection. So when you have a test done and all these tests are quote unquote normal, that does not mean that nothing's wrong. It does not mean that you don't have pain. And it doesn't necessarily mean, as we as providers are telling you, that these things are not. But we're telling you that you are not having pain because we're not finding it. What we're telling you is it's not X, Y, and Z. We don't quite know what it is yet. And if you are dealing with someone who seems dismissive about that, and not really breaking down to you, okay, we know you don't have these things. These things are more than unlikely. Maybe it is time to find another provider, but you do want to work with that provider. That being said, we are all humans. And if you still feel like you're not being heard, even if it's a provider you trust, it is important to get a secondary opinion. And you want to be careful not to have too many hands in the pot with that, because different physicians will work. We have different philosophies and the different ways that we work things up. But at the heart of it, you always need to have what it is that you want to get to in the bottom of it and figuring out more. And if that particular provider has seemed to exhausted their expertise, then maybe it is time to move on to someone else or figure out where to go next.
All right. Thank you, Dr. Curry. We have a comment here from Claudette. She says, I have my kids put the information about meds or anything that would be needed for emergency, put it as a contact on your phone. Nancy, what do you think about that, Dr. Utley?
I think your phone is the way that we should keep everything, because that's the one thing that people always have on them. They won't have their driver's license, but they'll have their phone. Usually a phone charger in their purse, but nothing else, no cash, nothing like that. But your phone is always there. I want to just jump back to Dr. Curry's comments. I can't speak enough to the importance of having a primary care provider who you trust. It's someone who knows you. It's someone who knows when something is different for you. I have a lot of patients that have the same complaint over and over and over, and I know that's normal for them. And we've investigated it and we've looked into it, and I've sent them wherever. And so when that's their usual complaint, because I have looked into it thoroughly, I feel comfortable saying, no, I think this is your anxiety, because we've worked up these 4 other things. We've ruled this out. I feel comfortable saying this is your anxiety. And when you see that patient in the emergency room and they're remarkably anxious because something else is going on, it's hard in that hospital setting to always make that call. And so when you have someone who knows you really well and you follow up from that hospital visit, it really, even beyond the visit, can help you tease out what's going on. I think that's an important thing too when you're talking about going to the hospital. You're not always going to know exactly what's going on. And so you're right. What were my test results? What did we rule out? What do these medicines change about what we're doing with my baseline medicines anyway? If you don't have a home base, it sets you up for multiple people doing things all to help, but maybe not honing in exactly what the issue is.
All right, Dr. Utley, thank you so much. And I want to ask, there is a percentage of people out there who are not insured and their interaction with medical professionals is sporadic at best. What do you say to those folks who have those sporadic interactions? How can they best set themselves up for a positive interaction, even if it's limited at best and you may not see them again? How can they make sure that that very limited interaction goes as well as possible? Dr. Utley, would you like to take that one? And then Myriam, I'll follow with you.
I think one of the key things, if you were financially limited from a medical insurance standpoint or finances in general, make the most of the visit when you go. So make an annual exam visit if you can do that. If there's any kind of free clinic that offers anything in your area that can look at the basics of what's your blood pressure, what's your sugar doing, are there other medical conditions that we can be controlling and helping you with, that visit could save you so much time and energy. There are lots of great programs. There, even, gosh, the Good RX app. I'm amazed at how much I can save my patients when they really are paying out of pocket for medicines just by looking and saying, oh, you get this filled here, it saves you $52. Like these kinds of little things that can make big differences when you're adding up the cost of medical care. But having somewhere where you go or something in your community, every community has different resources. We have some certain places in our area that will do, more often do pro bono. They will do a percentage of care based off of what your needs are. Knowing where those places are and trying to get in with them is really important.
All right, and Myriam, would you like to follow?
To Dr. Utley's point, outpatient, there are a lot of resources in your county, a lot of federal government resources. I would, have you reach out to different places, just even if you're reaching out to a clinic and asking, about any resources that they're aware of. They usually have a lot posted to provide to you. I know on the inpatient world, we would never turn anyone away with the lack of insurance. If you need care, you come on in and we're going to treat you. We also have social services that will find different avenues to help facilitate that, as well as grants and things of that nature. I can speak to Health Partners Park Nicollet. That's one of the things that we really focus on. We're truly committed to providing care that's welcoming and inclusive to all, no matter what is your demographic, what's going on in your financial status. This is not something that we want you to feel that you should not seek care just because of the fact that you do not at that moment have insurance. We can help provide that. We could have social services try to help that through medical assistance and things of that nature. So, to Dr. Utley's point, to Dr. Curry's point, and, reemphasized by Latasha over and over again, what's paramount, what's the key thing that we really want you to understand? Please don't let barriers be the reason why you do not reach out to get medical attention. What we don't want to have happen is that if you have diabetes, hypertension, any chronic illness of any sort, and you are deciding to stay at home because of the fact that you're worried that you won't be able to afford that. Let us help you facilitate that, but let us treat you first. Let's get you stabilized, and then we can worry about the rest of it later. I don't want that to be a reason why you choose not to seek care. And another thing I just want to mention, going back to what Dr. Utley said, the thing is that when you seek attention with a medical provider, whether it's a nurse practitioner, a physician's assistant, or a physician, again, it's collaborative care. We are here to serve you. It's not the other way around. It's not that you're coming to see us and that you should be putting us up on a pedestal. That's not what we're here for. We went to school so that we can have our license to serve you. That's our main goal. We want you to understand that we want you to feel comfortable. No matter what you're presenting with, you need to feel comfortable to be able to relay everything that's going on with you, and then let us coordinate care with you. Even if at that moment in time, what we ask that you want, say there's a treatment that we're asking and it's not something that you feel that you can handle, let us try to figure out a way so that we can do baby steps, so that we can maybe titrate as we need to make sure that we're kind of getting you to the care, to the optimal health that's needed. I just really want to emphasize that, primary care, Dr. Curry, what she does is she's front line, right? She's the one that can treat you. She's the one that can avoid you coming to see me. When you come to see me, that means that you're in an acute state, right? And then now I'm having to stabilize you and then send you back to Dr. Curry. So what I'm hoping that you understand is that coordinate with a primary care professional. Let them try to help guide you to whatever the optimal care is for you. You designate that and then try to avoid coming to see me. But if you do, I welcome you. I will treat you, and then we will make sure that we schedule you so that you would go back and see someone like Dr. Curry to help you.
Thank you so much, Myriam. When we did receive a comment from advocating from Family Values for Life saying advocating for yourself is so important and feeling heard versus being dismissed. Also, getting a second opinion can be critical to your health. Thank you for this very rich conversation. Thank you, Family Values for Life, for tuning in today. We have about 10 minutes or so left. And if you are watching right now and you have a question or a comment or anything you've heard is resonating with you, or maybe you have an experience of your own that just kind of connects with something that you're hearing here, certainly drop it down in the comments. And we can get those questions answered before we wrap up here in about 10 minutes. And then if you'd like to come up via video, the link is also available there in the comments as well. So Latasha, I know something that you've said before that would kind of piggyback off of what Myriam is saying. Sometimes people are afraid to go to the doctor because they think they're going to get bottles of medicine. And sometimes bottles of medicine may not be the first fit. Maybe there are things that you can do that won't require you to take medicine. Maybe there are lifestyle changes that you can make, but you can't know that without physically going in and talking to somebody about your issue.
Good point, Shayla. Yes, that is one of my favorite things. We always want to go to the least form of treatment. I mean, as far as like medication, I'm so sorry. Hold on. My thoughts are discombobulated. Sorry. Thank you, Shayla, for the question. I know exactly what you're talking about. And that is one of my favorite things. Oftentimes for like people with high blood pressure, the first time they enter the doctor's office and the blood pressure is high, they're like, I don't want to have a bunch of medicine. And so I just want to say that if it's your first time, there's lifestyle changes that can be made. Sometimes we as people, we live sedentary lifestyles where we're eating bad, we're not working out, we're not getting proper rest, we're not taking our multivitamins. So there's a plethora or a lot of things that we can do to possibly not have to take those high blood pressure medicines. And then even for diabetes, sometimes if we lose weight, change our diets, those are some of the things that we can also do that would help alleviate some of the medications or some of the insulins, depending on if you're type 1 or type 2. So I would just recommend starting there. Never be afraid to go into your provider to first find out what's going on. Once you know what's going on, then you can figure out with your provider what the next steps are to get the best possible treatment and outcome for yourself.
Thank you so much, Latasha. We have a comment here from Claudette. I believe we need to teach advocacy to our kids, our family members, also talking about end of life or what if moments help. So when the time has come to deal with whatever the issue is, you've had those conversations. Dr. Curry, would you like to comment on that?
Yeah, I think that's definitely very insightful. I think those are the conversations that we don't have enough. And I often tell my patients, you should have a healthcare directive, and they'll say their answer to me will be, oh, my wife or my kids already know. And I'm like, no, I work at the hospital. So I get into these situations where people have had strokes. They're unable to speak for themselves, but supposedly their family knew. But your family is also under stress, and there might be things that, you know, might be against what you actually want to do because they don't want to do them. And now they're stressed because their loved one is sick and they have to make these decisions, and they're not the decisions they would make, but you didn't actually write down what those would be. And it's very uncomfortable. It's very uncomfortable to think, well, if this happened to me, what would I want? Because nobody wants to think about their end. But I think at some point it is important to think about our end. I tell all my patients, you know, from the moment we're born, we all have an end date. And, you know, I think we ideally should have some idea of what we would want done to keep ourselves comfortable at the end, you know, even if you're not having anything going on. And that's why, again, I think, you know, healthcare directives, and like Myriam was saying, you know, having a pulse, which is a, you know, medical order about what you would want done, is important. But it is, I've lost several family members, and whereas, you know, my mother had that done, my dad didn't. And, you know, those are things we didn't have done, and we didn't know exactly what he wanted. And, you know, and now I know those things, and dealing with my patients too, I know those things, and working in the hospital. But they are hard conversations, but important, very important to have.
Thank you so much, Dr. Curry. We have another question from my mom, Linda Reeves. She's asking, as a patient in a hospital and you are not satisfied with the hospitalist assigned to your case, what other options does a patient have? Would you like to take that, Dr. Utley?
I think that's a great question. And I also think as a patient, I can imagine that's a very hard road to navigate, because you want to trust who you're with. And in the hospital, a lot of times you are kind of assigned. I think the first thing is for your nursing staff, maybe even the director of nurses over the floor that you're on, to be honest about that, to say, I need a second opinion. I don't feel comfortable with this. There's almost always another person available. And, you know, sometimes that causes hurt feelings with doctors and nurses, and it is what it is. This is your care. We're here to make sure that you're getting the best care, that you understand everything. And sometimes you're not lined up great with the right person who you feel like you communicate the best with. So asking for that, because sometimes what comes out of that is not that you get a new care provider, but you have a much better conversation with the care provider that you got, that they come in, they explain something, maybe they learn something about you, that they do that differently than they did before, just to bring their attention, like, maybe I haven't been as direct with that patient as I need to be.
All right. Thank you so much, Dr. Utley. And Latasha, a point I want to make sure that we include before we wrap up today, and it's something that you've said before, is if people are going to the hospital, call that friend or that person that you know and try to know a little bit of something about something, because if they think you know something, the kind of care that you receive will be different if they think you're just in there and you don't know anything at all. Learn like a couple of words you can write down, some things to ask. If that person can't physically be in there with you, just showing that you know a little bit of something about something could make a difference.
So I think it's really important that whenever you go to the hospital, that you kind of reach out to whatever medical person you have in your family or family friend, because a lot of times the language that can be used when trying to communicate with the provider, sometimes patients aren't using the right language. But if you have like a person that's a professional or that understands your scenario, they can help you so that the delivery of your message is correct when it comes across to the provider. Because a lot of times in the hospital, diagnoses are missed because oftentimes the health history or the interview process is not thorough. So just kind of having like a pre-gaming session can be beneficial for the person, and it also can help you get better care. And then also I like to tell people too, if they're not available before you drive to the hospital or you get there, you can always phone a friend too and have that person help you talk to the doctor. Doctors are really, really, really patient. they'll allow you to call the person, and they'll allow that person to help you get the delivery of your message across.
So important. Thank you so much, Latasha. And to all of our doctors and nurses, thank you so much for joining us for this conversation today. I want to quickly go around before we let everyone go. If you would like to leave everyone with a parting word or comment, what would you want that to be? I'll start with you, Myriam, and then we'll go to you, Dr. Utley, and we'll finish with you, Dr. Curry.
Summarizing points. I cannot stress it enough. One size no longer fits all. Your health does not fit into a box, meaning work in collaboration with your provider to come up with a health outcome plan that is most suitable to you and your family. Ask clarifying questions. Dialogue with your provider and discuss expectations. However, understand that this may need to be tailored by the provider to benefit you, right? And to give the most optimal long-term health outcome for you, which is the patient. Have at each primary care visit and hospital visit a current health history, prescription medication list, healthcare directive, pulsed, with a family member or friend present who is knowledgeable and may assist as indicated. I can't stress enough, especially in these current times, please, please, please get a COVID vaccination. I know we didn't mention that, but I have to mention that. Please, by all means, it's readily available. Please get a COVID vaccination. And lastly, as a provider, we can do better at listening and increasing our empathy. I'm going to be completely transparent with that. What we hope, what the key endpoint is to create a lifelong partnership in your care, whether it's in primary care, whether it's in the hospital, organization, outpatient, inpatient. The key is that we want you to stay lifelong with us. We want you to be healthy. We want you to be happy. We want you to be excited and feel that you're getting the best care optimally. Do not let financial reasons or any other barriers be a reason why you do not come in to seek medical care.
Myriam, thank you so much for that. And Dr. Utley?
I think one point to make is when you leave the hospital, when you get discharged from the ER, when you are closing that point of care, you need to know, when do I follow up? What things should bring me back sooner than my follow-up date? And what other things popped up during this encounter that need to be followed up on? The number of times that I see people who had a CT scan in the ER 2 years ago was something that should have been dealt with 2 years ago, but it wasn't the reason they came in, and maybe it didn't get on the back half their outpatient person followed up on. It's really important. What other little things popped up? What do I need to make sure I follow up on when I leave here? And that helps you help your provider not miss those things.
All right. Thank you so much, Dr. Utley. And last but not least, Dr. Curry.
All right, so all of the points as above, and then I have a few kind of little scraggling points. The first thing is, if you're in the hospital, again, even having someone to write down the questions and write down the answers for you. And even if you need someone to, if you need a person to be round when the doctor comes to round on you in the mornings in the hospital. I know one of the things that kind of came through with COVID, where we couldn't have any visitors at the hospital, is that we would Zoom a loved one. And so sometimes we do that while we were actually rounding and meeting with the patient, so that loved one could be there as well, and they could see what's going on if they had specific questions, and it would be another person that could hear what's going on. So I think it's important, write down your questions. The other thing is some systems, and I think this is going to be more widespread, but in some systems, including the Health Partners, Park Nicollet system, we have, and probably Alina would have this too in Fairview, you can go online, you can see your lab results, you can actually see your notes, you can see your results, which can be daunting for some people, but it also is, a part of it is increasing your advocacy, because you can go back and say, okay, The doctor said to do, or the provider said to do X, Y, and Z. Oh, here's the number for the people I need to call. I've been waiting for the orthopedics office to call me. They haven't called me yet. So I think it's important to, kind of look at your chart. You might not understand everything that's going on, but start to look at that. Look at your labs, and know what's normal. Look at the ranges. If you need help with understanding those things, meet with your provider also. So I think that's important. And the other thing, again, knowing why a test is done, what the results are, and knowing kind of next steps in your follow-up. And then also, I should say, again, medications. Knowing any medication changes is very important. Understanding that when you're in the hospital and understanding that a discharge, and then having that provider that you can follow up with, that also is kind of they're responsible for your global care. So when a person comes to me outside of the hospital, I'm looking to see, okay, what medication changes were made and why, what labs need to be done, who do they need to follow up with, do they have that appointment or not, what was the conclusion as to what caused this hospitalization, and so all of those things are important.
All right. Thank you so much, Dr. Curry. Thank you, Dr. Utley, Latasha Atkins Lee, and Myriam Roby. I appreciate you all taking a little time out of your Friday to join us for this important conversation. And if you missed part of the conversation, if you'd like to see the whole thing, the recording will be available as soon as we finish the live. It'll be available at the same link. Thank you all so much for joining us. Our next conversation in the Let's Chat series will be next Friday. It's on finding yourself alone. Sometimes it can be kind of tricky if life deals you some challenges and you find yourself trying to navigate a new space. Maybe you dealt with a medical situation that maybe caused you to lose your memory, and you may seem different to people who have known you your whole life. And so people kind of move away from you, or you might find yourself feeling more isolated. How do you kind of navigate that space? How do you get back to living and being your best self, even if those that you hoped would be around you may not be around you, and you have to find yourself in a different way? So we'll be having that conversation next Friday, August the 20th, followed by August 27th, divorce and co-parenting, learning some tips, tools, and techniques to keep your relationships out of court. And then September 3rd, we'll be talking about changing careers, feeling the fear, and doing it anyway. That could be daunting. A lot of career changers over the course of the last year as COVID has changed and flipped life upside down, and people are navigating what for them may be a new normal. Thank you all so much for joining us today. I hope you will be back with us again next Friday. All the doctors, if you can hang on here, I'm going to wrap up the live stream, and then I'll catch up with you here in the backstage area. Take care, everybody. Oh, we got one comment quickly. I'll get Ashley up here. Thank you, everyone, and for the amazing work you all do to serve patients. Thanks so much, Ashley, for that. We appreciate you.